The evidence for risk assessment tools and clinical decision support working in cancer comes at two levels. The important level is what is happening nationally. It's quite clear that over the last 10 years there's been a lot more diagnostic activity in cancer. More and more patients are being investigated for cancer. More and more patients are being referred for possible cancer. At the same time as these times between the first symptom being presented to general practice and the cancer being diagnosed are shrinking. Furthermore, cancer survival in this country is improving. Not improving as fast as we would like, but it is improving. And the proportion of patients whose first presentation with cancer is as an emergency is shrinking relentlessly. So all of these are national pointers and all going in the right direction around the same time that risk assessment tools and their sister methods of diagnosing cancer have been going on. It would be wrong of me to in any way claim that this is all due to risk assessment tools. There have been many other initiatives going on at the same time, but the timing is certainly right. So nationally, we can say things are improving. At a more local level, you can see that when risk assessment tools are made available to doctors, they do investigate more. And more cancers are uncovered. We've shown this quite clearly for colorectal and lung cancer. We also know that doctors are happy using them both in paper form and in electronic form. It's very difficult to then add the first bit to the second bit and prove that additional use of this diagnostic support is actually leading to cancer figures turning the right direction. However, the timescale is so encouraging. It does look as if better diagnostics have played a part, and I would argue a major part, of the improvements that we've seen over the last decade.